Hello. Thank you so much for being here today. I'm very, very honored to be invited to speak at this first annual Global One Health Symposium. And my name is Vicky Ramirez. I am the center manager for the Center for One Health Research, as well as co-director of the One Health Clinic. Um, Today, I'm going to be talking about One Health in clinical care and how we integrate human and veterinary healthcare to improve the health of the family unit here in the United States. See if it switches slides. There we go. So again, I am based out of the University of Washington in Seattle, and I'm part of the Center for One Health Research that has been here at UW since 2014. Dr. Julianne Meisner, veterinarian, is director of the center, with Dr. Peter Rabinowitz, MD, as deputy director, and Dr. Erica Furmeister as director of environmental health. The center is based in the School of Public Health and straddles the Department of Global Health and the Department of Environmental and Occupational Health Sciences. And at the center, which we call CORE, at CORE, we do research, much like many of you all probably do, looking at zoonotic disease transmission, and antimicrobial resistance. We do a lot of work with occupational health of workers working at that human-animal interface. And we look at environmental changes leading to increased exposures to animals and novel viruses, and animals as sentinels of environmental health hazards. But we also lean pretty heavily into the human-animal nature bond and its implications for health. Um, of course, I don't need to go into any of this part with you about One Health, but I just wanted to point out here that we include, so we're looking at this companion animal component, as well as all the social determinants of health that leads individuals into experiencing homelessness here in the United States. So when we started the center, like soon after, probably around 2015, 2014, 2015, we really were interested in exploring a One Health approach to caring for our community members experiencing homelessness who had companion animals. And so at that time, my colleague, Jamina Garland Lewis, who is an amazing photographer, she went and did a photo documentary with, I want to say 10 or 12 individuals, taking images, learning and listening to stories, and really getting to know a few people over time, to really get an idea of that human-animal bond between someone who is unhoused and the animals that they live with. And so, just taking a step back and putting into context, since this is a global event, um, homelessness, animal companionship, and healthcare in the United States is really not a single situation where all states have similar resources. So, at the national level, the service animals are the only animals with full protection to, be housed, travel with, go into stores or into other buildings. They have the full access support from the government, but each community, each city may have different approaches to animal companionship for those living in homelessness. So some cities, there won't be any services that allow individuals to bring their animals in. And there are some cities that are more welcome than other cities. Seattle is one of those more welcome cities. There are more human shelters here that will allow individuals to bring in their companion animals, not just service animals, their companion animals. But definitely not all shelters, even here in Seattle, allow for it. So there is a difference in how different cities um, provide services for those who are unhoused. Um, and in terms of healthcare in the United States, there are some clinics called federally qualified health clinics, sorry, federally qualified health clinics that are tasked with providing health services for individuals experiencing homelessness at no cost, and they will work on that on the back end through different kind of insurances, but they are, their goal is to getting more people into human healthcare. So prior to creating our One Health Clinic, we did a bunch of formative work. First, the photo documentary that Jamina did that you just heard about. But then we did some further work in both a mixed methods research study and a photo voice project, which I'll talk a little bit about, because it's really important to understand the community you're working with before you embark on creating a new clinical care model in the community. So when I was doing interviews with individuals, um, I use this quote a lot because it really kind of distills what that bond means to a lot of these people who are unhoused, who may not have any social network. This animal they're caring for may be their only family member. Um, but this quote really kind of embodies it. So one individual said, I have to have her. And I think every homeless person, I think every drug addict, I think anybody that is going through something where they think that they are at the bottom, that they don't have anything left, they need to put something first. And there's times when I was trying to quit meth over the last 2 years where I got out of bed because I knew she needed to use a bathroom. I didn't kill myself because I knew that she needed me. If you put something before yourself, oftentimes that one decision keeps you from doing the bad thing. What does the dog need today? If the dog's okay, I'll be okay. During these interviews, I also ask people about their animals' health and their health, as well as their animals' veterinary care and their own human health care. So when I talk to individuals, um, the majority of the people indicated that their pets were either very healthy or healthy. And the pets were always there during interviews, and visually, that appears to be so. There is a few people who indicated that their animals were fair to unhealthy, and those I saw them as well, and they were 17 and 18-year-old cats. So they were getting the older cat unhealthiness versus some kind of uh, other illness or disease or anything. And so all these people are saying that their animals were healthier than they themselves were. They indicated that their health was far less healthy than their animals. And when I asked about when's the last time their animals saw vet care and that they themselves saw human health care, they were accessing vet care more readily and more recently than their own human health care. In Seattle, as I mentioned, there are quite a few free veterinary services available for free for those with very, very low or no income. Donny Co-Pet Clinic has been running for free here in Seattle since I want to say the mid 80s. And so individuals will go to Donny and they will stand in line for 6, 7 hours in order to get vet care for themselves. But it was possible that they would not go through that effort to get their own human health care because they tend to often put their care of their animal first over their own own needs. Um, and in case you wanted to read that paper, here's the paper name, the QR code. When we do our evaluation and research, we make everything open access because the individuals who need to be able to access these manuscripts, like health services, like homeless health service providers, there's not funding to access journals. So everything is open access. While I was doing these interviews, my colleague Jamina was doing a photo voice project with individuals. So all of these, she had about 19 participants in her photo voice project, and she provided them with cameras, and they took their own pictures to show what their own lives were. With their animals, and the stories that go along with it. I remember this individual. He talked about how his dog would actually, at this shelter, if someone was really needing that emotional support, this dog would just like know that that person would need emotional support and actually would go and sleep with other individuals in the shelter space, if he felt they needed that kind of support. So this dog was super, super sweet. Um, People told stories about how they centered their whole day and their being around caring for their animal. Um, Whether it's living in an emergency shelter like the last dog, or within a minivan like this dog. Um, it was clear that these animals were very well loved and needed for various reasons. This individual he took his camera, they took their camera, and they went to this site just to show this area. And this area is where they almost 3 times they considered committing suicide. And each time they didn't, because they thought about their dog, and who would take care of their dog if they were no longer around. So these kind of stories kind of just really, really just showed how these animals um, improve the mental and physical health of their owners and of the people that are around them. And if you want to read that paper, this is the QR code to that. So in these two projects, key themes that came out of it were really that importance and strength of the human-animal bond, the mental and physical health benefits and motivation for daily activities, just getting up out of bed, going for a walk. One individual we talked to talked about going in the United States, there are dog parks everywhere where everyone goes and lets their dogs run around and play. One individual just talked about, going to a dog park and talking to other dog parents as though he was a dog parent and not someone experiencing homelessness. It gave that feeling of confidence of just being a human in community. Um, and the importance of animals for making and maintaining positive changes, whether that's decreasing alcohol consumption or getting into housing. A number of people that were unhoused when we first met them are now housed, and they state that it was for their dog. They wanted their cat to be indoors, so they worked hard to get into housing for their companion animal. But it also leads to lots of challenges related to experiencing homelessness with a pet here in the United States. Some shelters not allowing animals, some service providers not allowing people to bring their pets in. And how does someone get employment when they have to care for their animal and there's no place to leave them? So, with that in mind, we started just really working towards an idea of how can we take a One Health approach to addressing homelessness and animal companionship within the unhoused community, taking in consideration the positive and the negative impacts. So in the US, there's the current clinical care models are a traditional single care model where you go to the human health care practitioner and you talk to them about human health stuff, and then you go to the vet care and you talk about vet care stuff, but those never overlap. Um, uh, People are modifying in the last um, probably 8, 9 years, there's been more motion towards having a referral care model where maybe you have a veterinary clinic and you have a social worker there that is helping individuals realize that they should get seen by a human healthcare practitioner and get them an appointment and scheduled. That is great and it's very helpful, but there is barriers to follow through. Is there transportation to get there? Is there, will they remember that that appointment is at that time and at that location? Um, and the next care model is side by side care model, which is like a healthcare model where everyone is in the same region, in the same like parking lot. And so there's vet care, there's dental, there's human, there's social services. So you're done with one, and then you can walk across the parking lot and get services from another provider. And that's great. Everything that reduces the barriers to transportation and scheduling, but the services are still very siloed. And so we came up with this One Health clinical care model where the services are integrated so that the vet care informs the human health care, and the human health care informs the vet care, and they're treated and to create a single healthcare plan. And you're really building relationships through this vet care because veterinarians are trusted professions that the human healthcare can piggyback on. And so a con to this clinical care model is that it is slow going because it is relationship building. It is creating a healthy healthcare environment, maybe for the first time in many, many years through the vet care that that we hope that will blend into the human healthcare. And so, with Washington State University's College of Veterinary Medicine, we worked together and we found some federally qualified health centers that would be open to exploring this integrated care model. And then we collaborated with the University of Washington's University District Street Medicine, which is a student-led group of graduate and undergraduate students who are um, in the health sciences track. So pre-med, pre-vet, public health, social work, nutrition, dentistry. And so these students help the clinic run and help track the clinically relevant information that human healthcare can use to get people accessing human healthcare. So we do integrate the human and veterinary care. So the vet teams and the human health teams will collaborate on certain cases um, where things have risen to the top that are affecting both the pets and animals. So, for example, we have like a lot of the times our care is if you're healthier, your animal's healthier, just on a wellness level. And so that actually gets a lot of people accessing care. And then there's some things that get highlighted um, that are really prove that this integrated care is super successful. In such like an individual came in and she said that her cat was catching rats in the household, and it turns out she went to the vet care and said that, and then she went to human health care and decided to take a pregnancy test, and she was in her first trimester. So in real time, we're able to talk about toxoplasmosis and protecting the fetus. We have situations where a pet needs a painkiller, but the owner is working on sobriety or is on Suboxone and in sobriety, and we have to make sure that we maintain their sobriety while also caring for the pain of the animal. We also we're able to link mental health and behavioral health. So we say that that animals are able to feel the anxiety of their owners, and can we help you with your anxiety or your depression so that your animal can be healthier. And we also bring in environmental factors. So we're always talking about heat and cold, foods insecurity, not interprofessional, interpersonal challenges, um, access to clean water, location of encampment in case there's some kind of soil contamination. So we're always bringing in that environmental piece into our One Health clinic as well. We have a just say hello policy, so they may come just for vet care, but we ask them that they just say hello to the human healthcare team. And we don't require human healthcare clinics, but you'll see in the data that just having those touch points of just saying hello um, is getting people accessing their own human healthcare. It's a teaching clinic, so as I mentioned, the health sciences students from the University of Washington are providing flow and pooling those related healthcare concerns. But Washington State University's College of Vet Med has their vet students caring um, for the pets during this clinic, and so this gives an opportunity for um, human health services bound students to see the importance of collaborating with veterinarians and vice versa. So we looked at data from 4 years of clinic, and this clinic is based at a youth and young adult shelter. So um, these are individuals ages 13 to 25, and we were able to look at our One Health navigation forms, human health extracted data, and veterinary extracted data. And in that, we were able to see that 80% of all clinical visits that occurred during that time period eventuated in human healthcare being received. So, and then 69% of those human healthcare visits, when they walked in the door that day, our records say that they said that they did not need or want human healthcare that day. So that those 69% said no when they entered and then still got human healthcare for themselves because of that healthy, positive veterinary care experience that they had. So over that time, we saw 88 human clients, and 75% of those accessed human healthcare during that time period. 40 of those established healthcare for the first time in the past 2 years. So may have gone to ER before, but they established care that day because they brought their animal in for vet care. And of those 40, 85% had one or more human healthcare follow-ups, even on days that veterinary care wasn't being offered. So these numbers are far greater than we even thought was going to happen. It's been very, very successful at this particular clinic with this particular demographic. As mentioned before, we do bring environmental health into our One Health clinic. So we are educating constantly about how environmental risks that they feel affect themselves will also affect their animal, and those that affect their animal will also affect them. So in the ideal world, these two would be similar numbers across the board. So we try and educate when it is not. We work with homeless service providers, um, all different kinds of providers, in order to support them to support their clients to get into housing. So we do that through we created an emotional support animal letter that is inclusive of both veterinary and human healthcare sign-offs. So that we know that the animal is a safe and up to date in health and an appropriate emotional support animal for the owner. And so we create these letters, and this is a board that shows each key shows a youth and young adult that got housing in 2025, and each dog tag with the heart is a client that was housed with their owner. Wait. each client that was housed with their companion animal. We also evaluated this clinic from both the healthcare provider and client perspectives. Um, this has been a it's the providers have indicated that this has been very helpful for them because especially for veterinary teams, they may hear a lot about human health or human um, issues that the pet owner is having, but they do not have the capacity to follow through in human health, human health care concerns, or even social services. Um, like if someone is living in their car, that they all they can do is listen and express you know concern or sympathy, empathy for individuals living in their car. But because we are based in this shelter with human health care there, with case management there, with homeless service providers there, we're able to connect people. The veterinarians can hand off that weight rather than taking it home. And the same for the human health care practitioner. They they see that by supporting that animal and having the veterinary team there, they can actually build relationships with the client, with the human patient, by saying, "Oh, the veterinarian's right here. Let's talk to them about how to make your pet healthier." And then they're showing their compassion for that family member. Um, so that's that paper. We also created a free toolkit that a lot of people are using as they're exploring starting this clinical care model in their own community. I'm sorry, I forgot the QR code on this, but it's onehealthclinic.org. And we provide free TA. We really want to be able to help other organizations start clinics, um, as well as help evaluate the clinics in different regions so we can see the regional and demographic differences across different areas. And so right now we're working with New York City. New York City we helped them start their clinic in early 2023. We helped Tucson in mid 2023. I think those are the right years. We helped University of Minnesota start their clinic, and a few others around mostly the United States. But we're working with New York City on their data right now so we can help them publish um, their results of their clinic. And um, that is where I cut it off. There's a whole lot more. I do have 2 minutes, so I may just talk about a few of the other things. When you have one of these clinics, you can explore other research questions in the process. So we will be doing a pilot with our street medicine team. So going into encampments, veterinarians with backpacks, going with human healthcare practitioners with backpacks. Um, so that will be a summer activity, and we'll be able to evaluate that. We've done projects where we've done dog training that is co-taught between a dog trainer and a mental health care practitioner, where the dogs learn new skills and the humans learn complementary skills. Over those dog training courses. We're working towards evaluating a new detox and treatment center in San Diego that is allowing individuals to bring their companion animals into detox and treatment with them. If any of you have worked in this field, you know that that is a huge barrier for getting people accessing um, alcohol and drug treatment because they do not have a location or a safe space to keep their animal, nor do they want to be separate from their animals. So is detoxing with their family member a greater benefit than detoxing alone? Um, but there's so much more I could talk about. Feel free to reach out. It's been really fun working with different communities of different people wanting to do different things. This can be done with a rural community. It could be done with an agricultural community. This could be done with elderly communities. We just happen to start within the unhoused community. Um, but yeah, please reach out and thank you again for allowing me to present today.